Colleagues around the world had great respect for Dr. Scribner.
Patients who all died now could live.
He made a profound difference on the lives of millions of people.
Dr. Belding Scribner embodied everything we strive for in clinical research. His accomplishment was to change the entire paradigm of end-stage kidney disease into a treatable disease.
He woke up one morning with the idea that he should develop a shunt.
We connect the high-pressure artery with a low-pressure vein so that the blood runs through very quickly.
In March of 1960, with the Scribner shunt, patients were now able to live.
My early dialysis sessions were done in the basement of Eklund Hall, and we would dialyze overnight on the Kiel dialyzer.
Dr. Scribner was instrumental going back to Washington, D.C. to eventually get funding for end-stage renal disease.
It really was a miraculous kind of thing to be able to come and tell the Congress about. We now have the ability to save lives of thousands and thousands of people for whom kidney failure was a death sentence.
Belding Scribner was the first chief of nephrology at the University of Washington and also the founder of the Northwest Kidney Centers, a not-for-profit dialysis provider.
We now have a Kidney Research Institute, which is doing exciting work to bring advances to the field.
Dr. Scribner won the Lasker Award. He impacted medicine in such a profound way.
He was a miracle for patients. Without him, I wouldn't be here.
The American Society of Nephrology presents the 2020 Belding H. Scribner Award to Dr. Josef Coresh for his outstanding contributions to the care of patients with kidney disease. Dr. Coresh is currently Professor of Epidemiology and Biostatistics at the Johns Hopkins Bloomberg School of Public Health and Professor of Medicine at Johns Hopkins University School of Medicine. He is an international expert in kidney and cardiovascular disease epidemiology, having co-authored over 800 research articles, cited over 100,000 times. His research is diverse, following the blood vessels from the heart to the kidney and the brain, spanning a range of prospective and biomarker studies, as well as a clinical trial for correction of hearing loss to delay cognitive decline. He leads the atherosclerosis risk and community study at Johns Hopkins, a cohort of 16,000 participants followed since 1988. Dr. Coresh was vice chair of the 2002 NKF guideline, whose definition of kidney disease is now used globally. With Drs. Levy and Inker, he published the equations used for estimating kidney function globally. He leads the CKD Prognosis Consortium, which includes over 80 cohorts and more than 10 million participants from more than 40 countries. This research has informed clinical practice and regulatory policies. Dr. Coresh was born in Israel and moved to Chicago when he was 13. He received a bachelor's degree in mathematics from Princeton University, followed by a combined MD and PhD degree in epidemiology, as well as a master's in biostatistics from Johns Hopkins University. He stayed at Johns Hopkins, where he directs the Cardiovascular Epidemiology Training Program and the George W. Comstock Center for Public Health Research and Prevention. Dr. Coresh has received the David M. Hume Memorial Award and the Garabet Eknoyan Award from the National Kidney Foundation, and he was the inaugural recipient of the George W. Comstock Professorship in Epidemiology. He has also received the David M. Levine Excellence in Mentoring Award from Johns Hopkins University School of Medicine and the American Heart Association Epidemiology and Prevention Mentoring Award. The American Society of Nephrology is honored to present the Belding H. Scribner Award to Dr. Josef Coresh, whose work exemplifies the focus of this award. It has directly impacted the care of patients with kidney disorders and has substantially changed clinical practice.